statistic for the COVID crisis here in Massachusetts falls to its lowest levels in months. We've been explaining and reporting that to you.
Right.
So here to explain what it all means is Dr. Todd Ellerins, Chief of Infectious Diseases at South Shore Health. Dr. T, it's always great to see you. The number of new COVID cases has stayed below 100 every day since Sunday. And I'm going to directly ask you the question that we just asked on the air. Are we officially out of the woods?
We are doing really, really well right now, and I couldn't be happier. Right now at South Shore Health, there are only 3 cases in the hospital with COVID-19. With that said, I think that we need to vaccinate even more because of that Delta variant, okay? We know it's more contagious. The best way to reduce or prevent a resurgence is by even more of us getting vaccinated. So yes, we're doing well. I think we're out of the woods for a period of time, but in order to make sure that that period of time is as long as possible, we need more of us to get vaccinated.
So what have you heard, doctor, about the patients who are getting infected? We saw something yesterday that said most of the people who are hospitalized are unvaccinated. What do you know about this?
There are 2 groups, and Maria, you're 100% correct. One of the groups are the unvaccinated patients, okay? If you're unvaccinated, you have more of a risk of getting infected and getting hospitalized. The other group are immunocompromised patients. There, we're seeing a mix of unvaccinated and fully vaccinated. So I think in this group, there's 2 things I want to emphasize. One, still mask as much as possible when you're indoors, especially if you're in a crowded area. The second is if you get infected, as early as possible, whether you're fully vaccinated or not, get those monoclonal antibodies within 72 hours of your diagnosis. Talk to your provider about that. That can be life-saving.
Dr. T, you just talked about it a few minutes ago. You shared your concerns about this new Delta variant before. One public health official now refers to it as COVID on steroids. So do you think that there's a chance that it could force Massachusetts to roll back this reopening?
So 2 points here. Number one, yes, it's the most contagious variant we've seen so far, and there's some data that there's about twofold increase in hospitalizations. Okay, that's the bad news. Here's the good news. Recent study from the UK shows that after patients get 2 doses of either the Pfizer vaccine or in England, they're using the Oxford AstraZeneca, a 96% reduction in hospitalizations with the Delta variant. So these vaccine works, and just more of us should go out and get those 2-dose vaccines.
But no word on Moderna or Johnson & Johnson. They only study those other 2 vaccines.
Remember, Moderna is likely going to be very similar to Pfizer. Right. They mirror each other. They're the messenger RNA vaccines. With the J&J vaccine, we don't have that data yet because remember, J&J's only really been rolled out in the United States. And so far in the U.S., we probably have close to around 10% of the variants is the Delta variant. So we don't have enough information. Hopefully, though, that single dose will keep patients out of the hospital. Hopefully, but that remains to be seen.
Hopefully. The official start of summer is Sunday. Without getting too personal, is it going to go back to normal for you? Kids at camp, flying somewhere for vacation as an infectious disease specialist?
Maria, super excited about this. Both my kids are going to camp. Brett's going to an overnight camp. My daughter, Ruby, is going to a day camp, and they're both really excited. This is obviously a huge change from last summer. I'm hoping to get on a plane myself. Guys, any recommendations on where I should go?
I was just going to say, what camp are you going to? If the kids are going to camp, you have to go to camp too. Dr.
Is there an adult camp I can sign up for?
Just be well and be safe. All right, Dr. Todd Ellerins, thank you.
We're going to take you